On your phone.
Yeah, I'll just mute you all so that if that's okay, so that we start the session. So the session is being recorded. So a bit about what we're going to do in this unit. Okay. So yeah, welcome to this unit of so this is unit 1, where we're going to talk about the structure and overview of health and social care sector. We're mostly going to talk about the UK. Okay, so in our units, in our lectures, what we do normally is that I'm assuming that this unit has 4 learning outcomes. So we will be meeting every Saturday and Sunday. So we will be completing learning outcome 1 today and learning outcome 2 tomorrow. And then the next weekend, we'll have 2 more learning outcomes to cover. So that makes it 4 learning outcomes. And then the weekend after, we will have an assignment discussion. So whenever we have our assignment discussion, then you have 2 weeks time to complete your assignment and submit it to us. Okay, I'll give you the links where you need to submit, or whatever questions you have, you can always ask them. So this is a bit of an overview of the whole unit. So what this unit aims, it aims to develop your understanding of health and social care sector, where you are. Some of you are there, some of you are aiming to be there. And what are its aims and purposes? That it provides health and social care, and it also provides an awareness of the current issues impacting the sector in your chosen country. Okay, so we will talk about the UK, but then you will also focus on your own country. This is a bit about the unit itself. We will talk more in detail about this when we are doing our assignment discussion. Little bit about what you should be expecting in this unit. Okay, so your learning outcomes, number 1, will be to understand the structure and of health and social care provision. So we have health and social care provision. What is the structure of it? Okay, so we will go through that. And next we will, so these are again, we will be discussing them later on for your assignment, what we expect from you when we are assessing you. So just remember, this is the first learning outcome. So you will be understanding the structure and of health and social care provision. The next learning outcome for you is to understand health and social care provision for various ages and stages of life. So we have different ages and stages of life, and how do we need to understand the health and social care provision throughout these ages and throughout the stages of life. Okay. And then next is, the next learning outcome will be, the third learning outcome, will be to understand the different areas of specialism within health and social care. So you will be understanding the range of health and social care professions that you can opt for. And the fourth is to understand the issues in health and social care. Okay. So this is about a bit about, in a nutshell, what you should be expecting from these sessions. Now I will start sharing my slides for the learning outcome 1. Any questions so far? If you have any questions, you have the chat box open, so you can always ask questions. Please try and make it as interactive as possible. If you have questions later on, we can answer them, but it's best to answer your questions now, here, right there, and then if you have any. Okay, so I hope you can again see my screen. So this is the structure and overview of health and social care, Unit 1. The first learning outcome says that we need to understand the structure of health and social care provision. Okay. So what does this unit aim? We've talked about this earlier. So the different sectors when we talk about the NHS, there are different sectors within the NHS, okay, within the health and social care. So if we divide the NHS, we try and understand how the NHS is divided and how does it work. So the NHS is divided into primary, secondary, and tertiary care, okay? A bit about like the same structure varies a bit in different countries, but primarily it's always the first line of care where the GPs, the dentists, and the pharmacists see you when the cases are not complicated. Okay, and the NHS England is free. It provides care free at the point of use, and there are around 56.4 million people that it caters to. The secondary care, which is sometimes referred to as hospital and community care, it can either be planned, which is elective care, such as a cataract operation, or urgent and emergency care, such as treatment for a fracture. So these secondary care cases, they're mostly complex, more complex than the primary care. Okay, so there's surgeries which cannot be done in the primary care. And the tertiary care refers to highly specialized treatment like neurosurgery. You'll have transplants, you'll have secure forensic mental health services available at the tertiary care. So you can't have them at the primary or secondary care. Now we go on to explain the aims of health and social care provision. So you had mentioned, a few of you, that you are associated with social care, and you're also working in the healthcare sector. So healthcare provision itself, it's described for various healthcare areas. It's described as inpatient and outpatient care. There's rehabilitation, there's nursing services, prescribed medication, remedies, medical aids, and there are costs for different healthcare areas, transportation, and costs in total. Okay, so the healthcare provision, most of it is free, but at times you have to pay for some things that are mentioned over here. Social care provision. So social services provide support to people with learning disabilities. Their physical disabilities, there may be illnesses, there may be mental health illnesses. This support can cover practical activities, personal care, and social work. And these are intended to help the people receiving social care in order to live a comfortable life. Okay, so this is why social care provision is there. Some of it is free and some of it has to be paid for. Now we go on to explain the aims of health and social care provision. What do you think? What could be the aim of health and social care provision? Anyone there? We've talked about it earlier. What is promoting health and well-being in health and social care? What does it mean? Anyone? Anyone? Okay, never mind. I always aim to have it a two-way discussion. That's how we work best. Anyways, promoting well-being will involve actively seeking improvements in aspects of well-being when carrying out a care and support function with regards to an individual at any stage of the process. Okay, so there's actively seeking improvements in aspects of well-being. And this is when you're caring and supporting for someone. From the provision of information and advice, so you're giving advice and information, And you can also be reviewing a care and support plan. Even in that process, that is also known as promoting well-being. Okay. So a bit more about this. So when we explain the aims of health and social care provision. So what is the definition of well-being? Well-being is a broad concept. It is described as relating to these areas in particular. So there's personal dignity, including treatment of the individual with respect. So whoever it is, whatever age they are in, whatever gender they belong to, whatever race they belong to, whatever religion they belong to, this is our duty to treat them with dignity. Physical and mental health and emotional well-being. That is one of the aims. Protection from abuse and neglect as much as we can. So if there's a safeguarding issue, that is everyone's duty. That is your duty. That is my duty. Doesn't matter if I'm a teacher, I'm still associated with healthcare. That is my duty as well. Control by the individual over day-to-day life, including over care and support provided and the way it is provided. Participation in work, education, training, or recreation. So if they're looking for work, get them involved in activities where they can find work, where they can find ways to get educated, training or recreation. This is our duty. We need to signpost them. We might not be educating them. So if you're in the healthcare profession, you're not going to educate them. I'm teaching a degree where I am teaching master students, for instance, and I cannot take a bachelor student, for instance. I will then signpost them to the proper departments. Social and economic well-being, domestic, family, and personal relationships, suitability of living accommodation, and individuals' contribution to society. So we are not directly involved. However, we should be indirectly involved in all of these. And it's not just your duty or my duty, it's everyone working in the health and social care sector. It's everyone's duty. Now we go on to further explain. So keep people healthy. So this involves involving people in their care and treatment, means supporting people so that they can manage their own health and well-being. Okay, so you're making them so independent on a daily basis that they're able to manage their own health and well-being. And this means also to support them to become involved as much as they want to or are able to in decisions about their care. And you're also giving them choices and control over the NHS services that they receive. Different ways of involving people in their own health and care. So how can you involve them? For instance, if a person wants a pill instead of a syrup, which is bitter for them, or a person wants a syrup instead of a tablet for as a choking, it might make them choke. They don't have a hazard, like you can't see any physical reason for them to be choking. However, if they don't want it, then you don't go for it. Okay, so you try and do what they want in their best interest. So if that harms them, or if the dose is not complete because of what they're asking for, you then refrain from them and then do whatever they want, but also keep in mind that their health and their safety is should be of prime concern to you. Then we involve people.
Is it
We
is
involve people.
decisions?
Sorry?
Is it like considering the decisions?
Yes, we are considering their decisions. Yes. So if there's a carer that's coming to them in, let's say the carer wants to come early in the morning, and they're not a morning person, they want that carer to come in the afternoon or later in the evening. So you'll do whatever you can to make that possible for them, so that they're able. And that gives them independence also, isn't it? So you're giving them the independence that, yeah, they're independent, they can handle their own scheduling, they can handle their own, and that feeling of independence is amazing. so that you're making them feel that what they want is also important. Their say is also important. It's not just you deciding for them. Okay, and so it's what matters to them most. Okay, so not only does this acknowledge the individual as an expert in their own care, but it also gives people greater choice and control over the care and support that they receive. I hope that's clear.
Yeah.
So, yeah, thank you. So when we involve people in their own health and care, there's personalized care and support planning. So it's a systematic way where we ensure that individuals who live with one or more long-term conditions. So for instance, there are diabetes, there's hypertension, you're living with dementia, you're living with Alzheimer's, you're living with arthritis, things that go on for years and years, they're chronic diseases. Okay, they are supported through proactive conversations. And this is with their clinician or health and care professionals. Okay, so you're all getting involved as a team for their care and their support planning. There's shared decision making. Okay, so you're making decisions, but and it's a teamwork that's making decisions. It's the team of pharmacists. There's a team which involves doctors, physicians, nurses together. And the team also involves the patient themselves. So it's a process in which people who experience a change in their health work together with clinicians to select tests, treatments, management of support packages. Okay. And then there's self-management. So it's a term given to the range of approaches that aim to enable people living with long-term conditions to manage their own health effectively. And then making health and social care accessible. So everyone should have access to high quality health and care information, and this enables them to better understand their conditions. So since August 2016, all the organizations that provide NHS care or adult social care, they are legally required to follow the accessible information standard. Just have a look at this. I'll just put this in the chat box. Just a minute. So these links, I'll be putting them. It's not letting me open it. Just a minute. Yeah, this is the link. So I'll just put it in the chat box. Have a read of this. So you will have to do some additional reading when you're going through the sessions because you have to do your assignment. So your assignment would require you to read extra to complete the assessment. Okay, so just have a look at it where we try and make health and social care accessible to all. And then we go on to support those in need of medical and social care. So the social care system, it is in place to provide help to those that are in need, such as individuals who have mental health problems, their learning or physical disabilities, and their vulnerable adults and children. So there's a broad range of services which provides a safety net to those most at risk and has been built into our society for several years now. It's been hundreds of years. And then supporting those in need can be implemented in a number of ways, like you care and support needs assessment. So there's a needs assessment where you assess what are the needs, what are the requirements of an individual that you're caring for. And then you're supporting those needs. So a health and social care assessment, it's carried out by the social services. This is to find out what help and support you need. So there's help and support like healthcare equipment, help in your home. You need a mobile chair. You need a wheelchair, for instance. What is it that you require for your support that can best support you? Residential care, etc. So it's not just hospital care, it's care at home as well. Developing your health and social care plan, that's very, very important. A good care plan can add so much value to your health improvement. So there's individualized care plans that cover a number of areas. So there's care plans that are there for everyone, and then you tailor those care plans according to the individual needs of the person that you're caring for. So the care needs are identified in when you're assessing the patient, how your local authority intends to meet your care needs. Your personal budget is looked at, what you can afford, what you cannot afford, that all is looked at. An assessment of the ways your needs can be reduced over time and how to prevent future needs occurring. So individualized care plans, they will aim to support you in some of these ways. So they will encourage and support you to live a healthy life and independently, to have as much control over your own life and over your own health as much as possible, to participate in the society as an equal. So even if you have a disability, you're still contributing equally in the society, to have access to employment and family life. So if you don't have a job and if you're looking for a job, you have access to the support there. Hello, Elizabeth. And then family life as well. Ensure you have the best possible quality of life and ensure your dignity and self-respect. So sometimes you will be saying, that doesn't happen. Sometimes you will be saying that, oh, I look around myself and that's not happening. Well, if that's not happening, that is not right if it's not happening. That should be happening. That is what we are talking about, so that when we know these things should be there, we can make a difference then. And it is your duty and my duty to make a difference. Now we go on to the second part of the first learning outcome, where we describe the organization of health and social care provision within your chosen country. So sometimes in your assessment, you will be asked to compare and contrast between your country, let's say Nigeria, let's say Kenya, whichever country you belong to, and compare and contrast it with the UK. So the UK has a government-sponsored universal healthcare system, which is the NHS. So the NHS consists of a series of publicly funded healthcare systems in the UK. So there's public funding in it. Whatever goes into taxes, that goes to the NHS, whatever taxes you and we pay when we're working. And it includes the National Health Services for England, NHS Scotland, NHS Wales, and Health and Social Care in the Northern Ireland. Citizens are entitled to healthcare under this system, but they have the option to buy private health insurance as well. Okay? Any one of you who knows about private health insurance, what is the use of private health insurance? Why do we use private health insurance? Anyone? Why do we use it? Anyone?
Why do we use what?
Private health insurance. What is the use of private health insurance when we have health facilities already that are all free of cost?
Is it like private health insurance gives you like, in case you have something very like an illness that's very delicate that the public services can't fund,
Mm-hmm.
the private health insurance covers it?
Okay. Yeah. Yeah, you're close enough. Anything else? Yeah, so for instance, if you have health insurance and you want to see a doctor right away, let's say, and there's there's not much the free services can do for you at the moment. So you can always use um, your health insurance to cover you. So the cost will be minimal. There will be cost, but it won't break your back, because private health is extremely expensive over here in this country, in any country. So you should be insured, whether you belong to this country or any other country. It always helps you in times of need. So the NHS consists of a series of publicly funded healthcare systems in the UK. So it includes the National Health Services, the NHS England, NHS Scotland, NHS Wales, and Health and Social Care in the Northern Ireland. So the citizens who are entitled to healthcare under the system, but they have the option to buy private health insurance as well. Okay. If you cannot access it, if you need more complex care. Now we go on to describe the organization of health and social care provision within your chosen country. So this is a diagram. It's not very clear. I'll just go through it with you. So this is the structure within England of the NHS. So the NHS plan promises more power and information for patients, more hospitals, beds, availability of them, more doctors and nurses. So this shortens your waiting times for appointments significantly. This all happened before COVID came. Okay, COVID disrupted a lot of things, but it's going back to normal now, hopefully. There's improved healthcare for older people, tougher standards for NHS organizations. I'll just go through this figure in a while. So the UK's health system is one of the most efficient in the world, according to a study of 7 industrialized countries. So the Commonwealth Fund report, there's a report that came out that looked at 5 areas of performance, where they looked at quality, they looked at the quality that is provided of healthcare, health and social care, the efficiency with which it is provided, how much are the people able to access care, equity, and healthy lives. So within these domains, it was the Netherlands that ranked first overall, closely followed by the UK and Australia. So the UK performed well when it came to quality of care and access to care. It also ranked first in efficiency, which was measured by when they examined the total national expenditure on healthcare as a percentage of gross domestic product, or GDP, as well as the amount spent on healthcare administration and insurance. Okay, so the quality was ranked first within the UK and efficiency as well. So the healthcare system in different regions within the UK, how does it vary? So the healthcare in the United Kingdom, it is a devolved matter. So devolution means that it has been broken down according to different areas. So different domains have been made. So England, Northern Ireland, Scotland, and Wales, they have their own systems of private and publicly funded healthcare. And there's alternative, holistic, and complementary treatments as well that exist within the UK. So the fact that lies that each country has its own varied policies. So you have policies that are there that are different for Northern Ireland compared to England, compared to Scotland, compared to Wales. And their priorities have resulted in a number of differences between the systems. Okay, so within the UK, there are different countries that have different priorities, not the same across. So each country provides public health care to all UK permanent residents, and each also has a private healthcare sector, and this is significantly smaller than the public health sector, which is accessed also very less by the public because of the expenses. So the most healthcare in England, it's provided by the NHS, England's publicly funded healthcare system. So social care services, they're a shared responsibility between the local NHS and the local government's directors of social services, and this falls under the guidance of the Department of Health. So similarly, most healthcare in Scotland and Wales, they're provided by NHS Scotland and NHS Wales, respectively. So a majority of healthcare in Northern Ireland, it's provided by Health and Social Care in the Northern Ireland, which is still often referred to as the NHS for convenience. We still call it as NHS within the Northern Ireland. And then we talk about how is it government funded or is it private? How are they different? What makes them different? What are the structures of each? So healthcare in the United Kingdom, it's publicly funded and it's paid by taxpayers. However, the UK also has a private healthcare sector in which healthcare is acquired by means of private health insurance mostly. And this is typically funded as part of an employer-funded healthcare scheme, or it's paid directly by the patient or the customer. Okay, so yeah, either you have an employer-funded healthcare scheme or it is paid directly by the customer. Private healthcare has continued to exist and paid for largely by private health insurance, okay, which makes it easier for people to access health. Most health insurance products, they're distributed by the NHS. Only very small sector is distributed by private insurance companies, but they're still there. Then there's a divide between the rural and the urban. So on average, the residents of most affluent rural areas, they live longer and lead healthier lives than many of their urban counterparts. This is seen across across the world. So research that is being conducted on UK healthcare, so it usually focuses on urban environments where there's higher levels of deprivation, there's poor health, there's social needs, there's inequity. There are all sorts of problems. However, the rural communities often find affluent and poor living in close proximity to one another. So urban health seems to be generally worse off than more of the rural areas because there are expectations to this rule. But there are exceptions to this rule. So what happens in the rural areas? There's poverty, there's illiteracy, yes, but there's no stresses like mental health. There's more mental well-being there. There's more close proximity to nature there, and people, they have whatever they have is more natural there. Okay, so you are what you eat. Mostly we hear that. There's more peace there. Anyone who lives in a town compared to a city will know that. I know that a lot. That's why I love my town. I love my, it's not very rural, but it is more rural than most of the urban areas. So there's less chaos, there's less stress. Yeah, that's what I feel. And then there's a bit about what the urban environment offers. So the Department of Health is responsible for improving health and well-being for people of England. You have NHS primary care trusts that have been established, and these are there to improve the health of their local population. And they work jointly with a wide range of partner agencies to commission hospital and community services and to develop primary and community care services. There's strategic health authorities, and the goal of these authorities includes to ensure that national priorities for health are integrated into local plans and strategies, and building the capacity of the health services, and ensuring high quality performance is found within the NHS. Now coming towards the rural areas. So the countryside agencies, their stated mission is to make life better for people in the countryside and to improve the quality of the countryside for everyone. So there's the Institute of Rural Health in the United Kingdom. So it's a UK-wide academic charity that was established in 1997. And this works to inform, develop, and promote the health and well-being of rural people and their communities. This is through 3 main academic program areas. So it's research and projects, where there's contribution to evidence base. There's education and training, where there's developing a workforce fit for the purpose, and there's policy analysis, including rural proofing. Now coming towards, I think this should be the last slide we will be doing, regulation. Just a minute. So we might have to divide this lecture into 2 parts because we're not at all going to complete this in one go. Yeah. So coming towards the legislation, self-care and self-regulation. So the Health and the Social Care Act, we'll talk about different legislations here. That was introduced in 2012. The first legal duties were there about health inequalities, and it included specific duties for health bodies that included the Department of Health, Public Health England, clinical commissioning groups, and the NHS England. And these required the bodies to have due regard to reducing health inequalities between the people of England. This act, the Health and Social Care Act 2012, it also brought in changes for local authorities on public health functions. So this is one that we know about. And then the second one is the Equality Act 2010 that was established, and it has the duty that for all public sector bodies, and it aims to integrate consideration of the advancement of equality into the day-to-day business of all bodies subject to the duty. And then we have the Social Value Act 2012, which requires public sector commissioners and including local authorities and health sector bodies to consider economic and social environment well-being in the procurement of services or contracts. So these are 3: the Health and Social Care Act 2012, the Equality Act 2010, and the Social Value Act 2012. And then there's the Health and Safety at Work 1974, and this sets out how employers, the employees and self-employed people must work in a safe way as much as possible. And they give every person on work premises legal duties and responsibilities. Then there's control of substances hazardous to health regulations 2002, and this is designed to protect people from hazardous substances. Any substance that can cause harm or ill health. Then there's reporting of injuries, diseases, and dangerous occurrences, RADOR 2013. This is reporting accidents and incidents which is an important part of work in any health or social care workplace. Then there's the regulatory reform, fire safety order 2005, which sets out how every workplace must prevent or protect against fires. We'll start these, the size of sector of finance tomorrow, if that's okay. I try and keep it so that you don't have to go through so much in one day. I'll pause the recording.